Within the organisation we were trying to think up innovative ways to move our patients maybe into other settings to create some bed capacity for us.
When it first started, it was seen perhaps as more of a cost-saving exercise rather than true benefit for the patients, and quite a few of myself and colleagues were fairly sceptical. This changes the way we've treated patients in the past. Now I see it actually as a positive advantage for the patients rather than saving any money or trying to get them out of hospital quicker, and we found that keeping patients in hospital unnecessarily is both expensive and also does cause further problems for patients.
We do IV treatments at home, we do Clexane bridging in patients' homes, we do the rehab, the physio for kind of joint replacements in patients' homes. You can change the length of stay for simple operative procedures from being maybe 2 or 3 days to actually going home on their day of surgery and having that initial post-op period being done in the patients' homes.
There's been about 1,200 patients referred onto the healthcare at home service. For us has meant that 7,600 bed nights that would otherwise have been consumed in the hospital have been in patients' own home. There's been around 10,000 home visits from the healthcare at home team, and that's amounted to about 35 to 45 patients at any one time that are on the healthcare at home service who would otherwise have been in hospital beds here within the acute hospital.
It was good for the trust because it allowed them to have better throughput through the hospital, and obviously it's much better for the patient because patients much prefer to be in their own environment. Evidence suggests that patients recover much better in their home environment, and who wouldn't want to be at home?
People with long-term conditions especially are very, very used to their condition and the way they need to be treated. But the nurses have been fantastic with that and very open to talk about how I need my treatment to be given. And I'm aware that the nurses meet with the CF team regularly, I think every week, to discuss the patients, which gives that real sense of security, I guess.
We spent a lot of time looking with healthcare at home about the quality of their staff, whether or not their staff had the skills and capabilities in line with staff that we would expect here at University Hospital Southampton.
We rely very heavily on the nurses here and the sisters and the nurses that we worked with for many years. So one of the first things was that we wanted to know who was going to look after the patients.
We made sure that we built up a relationship between the staff from healthcare at home with our ward staff and with our consultant staff. So actually the healthcare at home team became embedded within the hospital overall.
It enables patients to recover at home, and that we can also keep an eye on them because they technically still are under our care, and if there is a problem we can get patients back in very quickly.
The partnership with healthcare at home does allow us to use the expertise, knowledge and innovation to bring those skills into the hospital sector so as we can benefit patients. Part of the service that they have is a 24-hour helpline that's available to patients. They provide a rapid response team 24 hours a day, 7 days a week, 365 days a year, which is a level of infrastructure that gives added value to our patients and to our clinicians when working in this type of way.
People have always thought that actually the patient needs to be in hospital, you looking at them on a daily basis or part of your team doing that. But actually I think healthcare has changed, and I think the majority of patients now actually prefer to go home. And I think with a setup that can see the patients in their own home, because we're here less frequently than we used to be in traditional days, then actually I think going home for the patient and getting cared for at home is probably better. I think it was really asking the patients when they came back to clinic that I got such positive responses that actually I started putting more and more into the system.
You know, in a year, in 2 years' time, this is going to be the normal way of caring for patients post-operatively, post-acute illness. The home is a far, far better setting. It's just the start, and it's going to grow massively.